Binds to adrenergic as well as dopamine receptors. We typically say D1, alpha 1, and beta 1. And we typically say that which receptors are bound depend on the dose. With increasing doses, you go from D1 to beta 1 to alpha 1. Classically taught that way, but in reality and clinically, there really isn't that nice gradation. It's given as an IV infusion of 2 to 5 mics per kilo per minute. It increases your cardiac contractility as well as, therefore, your output. It increases your heart rate. It is a chronotrope, positive chronotrope. It increases your urine output. And at high doses, it causes vasoconstriction. There's been multiple randomized control trials on the use of dopamine to increase urinary output, specifically in post-cardiac surgery. And even though dopamine may increase your urine output, which makes you feel better to see that your post-cardiac surgery patient is making urine, it actually doesn't change any renal outcomes. Side effects, however, do include tachycardia as well as other arrhythmias. And I have seen it many a time where we have started dopamine to try to improve urine output. And even though it does that, we've probably or may have caused a patient to go into atrial fibrillation. It used to be recommended as an agent that could be used for improvement in blood pressure in septic shock, but the new SCCM guidelines does not recommend it as the first-line agent. There was a randomized control trial in septic shock, and what it basically found was that Levophed and dopamine pretty much gave you the same blood pressure improvement, but dopamine had a higher rate of adverse effects, specifically atrial arrhythmias. So we, again, don't go for it as a first-line agent. Epinephrine binds all 4 adrenergic receptors, alpha 1, alpha 2, beta 1, and beta 2. And as such, it causes bronchodilatation. I apologize for that. It does not cause bronchoconstriction. It causes bronchodilatation via the beta 2 system. It causes vasoconstriction via the alpha 1 system. It increases your contractility via your beta 1, as well as can cause a tachycardia via the beta 1. Now, I will say that these are all traditional teachings. It can also, at low doses, 10 to 20 nanos per kilo per minute, actually cause vasodilatation. It inhibits mast cell degranulation, and therefore it's the drug of choice for anaphylactic shock. Often it's given IV. In the ACLS guidelines, it's 1 milligram during cardiac arrest. For bradycardia, you often see it used as 2 to 10 mics per minute, as well as for inotropy. And when somebody doesn't have an IV and they come in with having some severe anaphylaxis with bronchoconstriction, you often give it intramuscularly, 300 micrograms right on the lateral part of the thigh, repeated every about 20 minutes. How about Nor-Epinephrine, also known as Levophed? Binds primarily alpha 1, but can also bind beta 1. It primarily causes vasoconstriction, but classically we're taught that it can also increase cardiac output. There's some newer studies showing that it does increase your cardiac output. It's not clear to me based on the data whether it's due to the fact that it possibly constricts the venous system and therefore increase your preload, or possibly that in septic shock, where about 20 to 30% of patients develop septic cardiomyopathy, it may increase coronary perfusion pressure and therefore improve cardiac function, therefore output. It is the drug of choice for septic shock, according to the Society of Critical Care Medicine guidelines. It is dosed IV, and the usual dose is 4 to 20 mics per minute, but it can also be given as a bolus of 4 to 8 micrograms. And I've often seen it cause reflex bradycardia. I can't recall ever having seen it cause tachycardia.
Guys, thank you very much for watching. Make sure that you like, subscribe, and share this video. Like it if you like it. If you don't like it, then don't like it. And then subscribe if you want more videos. We upload videos regularly. So if you subscribe to the channel, you can get a notification and the video will appear in your inbox. And if you hit the bell button as well, then you can get the notifications for this as well.